Good afternoon and welcome to the Midday News. Here's what we have in the bulletin.
Digicel announces major shift in its media strategy with the immediate closure of Loop News and SportsMax. Caregiver arrested after corpse was found in house. And later in sports, reggae boy Richard King has arrived in Scotland to take up 2-year club contract.
Thank you for joining us. I'm Kerry-Ann Simpson. Here are the details. A press conference is now underway as the government continues to defend its rural school bus service for students. It comes amid mounting criticism by the opposition.
The government is mindful of this to the public transport operators. We are partnering with them to allow for them to be able to earn maximum. The opposition is trying to put a divide between the transport operators and the government. It's nonsensical, because the fact of the matter is that you have not heard one cry from any public passenger association or even the operators themselves, because they live it, they know it. And the fact is, if I can take off 28,000 students off of their routes so that they can take that much more adults paying full fare, then it is a win-win for both the government, the transport operators, the parents, the teachers, and the children.
In the meantime, opposition Senator Peter Bunting says the buses being deployed for the rural school bus service are not safe. He challenged the government to a public debate on the matter. Mr. Bunting was speaking at a PNP meeting in Christiana on Sunday.
These buses that they're bringing in, these are not pre-owned vehicles. These are retired old bus. Many are over 10 to 15-year-old with hundreds of thousands of miles on the clock.
So far, 25 of the 110 buses have arrived at Kingston Wharves. Local Government Minister Desmond McKenzie is accusing PNP councillors of creative mischief about not being in receipt of funds from members of Parliament. Speaking at a party meeting in Santa Cruz, St. Elizabeth last night, Mr. McKenzie said the money given to the MPs is typically used for spending on the entire constituency.
Each councillor don't have to depend on MP for money, because every councillor, the 228 of them, both GLP and PNP, gets a monthly allocation.
Mr. McKenzie also hit back at claims that the local government ministry has not been providing funds for councillors to carry out road repairs.
The councillors get an allocation from the parochial revenue fund for the repair and maintenance of roads in each municipality across the country. So when the councillor tell the people so them now get no money from the Ministry of Local Government, I lie, them lie. I am going to provide a list of the allocations that have been made, especially to that councillor who keep telling people that him now get no money to fix road.
Telecommunications provider Digicel has announced a major shift in its media strategy with the immediate closure of its digital news platform Loop News. It also plans to shut down its sports broadcaster SportsMax by August 8. In a statement Tuesday, the company confirmed that affected staff have been notified. The telecoms provider says the move reflects a strategic pivot away from consumer media towards expanding its enterprise and digital service offerings under Digicel Business. Now, Loop News, which was launched in 2014 and became a prominent regional source for digital news, while SportsMax, which was launched or established rather in 2002, played a key role in Caribbean sports broadcasting. A 54-year-old woman is in police custody in Westmoreland following the discovery of a corpse at the home of a senior citizen she cared for in Big Bridge. The senior citizen has been identified as Viola Destin. Police believe she has been dead for some time. It's understood that the caregiver who lived with her did not report her death because she told the police the woman was not saved. She further told investigators that God told her to keep the body. She has been caring for the woman since 2023. Now, we'll have more on this developing story in subsequent newscasts. We must move forward while the transition takes place. The word from President of Guyana, Dr. Irfaan Ali, as debate continues to rage over the full implementation of free movement of CARACOM nationals in the region. Our reporter Anthony Lugg has been speaking with regional leaders at the 49th CARACOM Heads of Government meeting.
From airports to seaports, CARACOM nationals have found that free movement isn't always as free as promised. For years, inconsistencies in immigration enforcement across the region have undermined one of CARACOM's key commitments, the rights for citizens to live and work across member states without hassle. And so, discussions are ongoing.
There's not a full consensus coming from all countries, but there's a protocol that allows at least 3 countries to start the process.
At the 49th Heads of Government meeting, we asked regional leaders about their pledge to fully implement the CARACOM single market and economy. Dr. Irfaan Ali is president of Guyana.
I've seen great progress. In the last, I would say in the last couple of months, Prime Minister Motley has been working aggressively over time on this. I think there is the appetite and the commitment. Some countries, of course, would need some more time to transition. I think we are finding the right language and the right framework to support that transition. But I think where we are at now is at a position where we must move forward whilst the transition takes place.
The revised Treaty of Chaguaramas and subsequent protocols provide the legal basis for freedom of movement. But not everyone has benefited. CARACOM nationals have been denied entry, detained, or deported, sometimes without explanation. Prime Minister of Antigua and Barbuda, Gaston Brown, wants free movement to be embraced.
There's no doubt that if we didn't have that free movement, our population would have been significantly smaller. And some of the major capital projects that we pursued, we would not have been able to pursue them. So for us, free movement works and it should be embraced. We have asked for a derogation because of the fact that the domestic population is now in minority and it has now become a political issue. But having said that, we're still allowing, we haven't stopped anybody from coming to our shores, any CARACOM national from coming to our shores.
Anthony Lugg, TVJ News.
Jamaica's health sector has received a boost with the arrival of 4 volunteer nurses from Nigeria. They will serve for 2 years. Their arrival comes through a partnership between the Jamaican government and Nigeria's Technical Aid Corps program.
The Ministry of Health says the move is timely and necessary as Jamaica continues to struggle with shortages in specialist areas. This includes emergency care, psychiatry, midwifery, and more.
This is the first tangible, real, touch and feel result of a lot of negotiation and discussions that have been had over the last couple of years. last 2 years in particular, we've been working with the Nigerian team, and also, as Minister said, working with the Philippines and India team. But we have had other, interventions over the years. We have our Cuban partnerships. In the past, we've worked with India, doctors from Burma, nurses from Nigeria.
To address the gap, the ministry is rolling out a major plan to increase nurse training and entry-level RN jobs.
What is unquestionable is that a collaboration is necessary to address the needs that exist. It is non-debatable, it is not negotiable, because those needs will impact the quality of care if they are not met, if they are not satisfied. And unfortunately, we do have significant gaps in our capacity and our skill sets, specialized skills to address those needs. So I think that needs to be very clear, and we must echo that sentiment.
2 of the Nigerian nurses are PhD-level educators in community and mental health nursing and will support local nurse training. The other 2, both seasoned specialist nurses, will mentor trainees under the Southeast Regional Health Authority. The nurses are starting work immediately.
I've been in this business for the past 17 years, and we're down here to help with the training of nurses in the area of psychiatry and mental health nursing. Which mental health is total health.
So I hope to really give in my best in that regards to Jamaicans and to really impact to the healthcare system and to the educational system, depending on where I'm being posted to. And I hope to really have a fulfilling time here in Jamaica. And of course, to make Jamaicans happy and, of course, make Nigeria proud.
Shamela Pullen, TVJ News.
Meanwhile, Health Minister Dr. Christopher Tuffton is urging more registered nurses to get themselves trained in specialist areas. He says this will help to bridge the gap in the system.
Encouraging those of us who have an interest in this field to benefit from the educators who are here and others, so that their training can be targeted to the needs that exist in the marketplace, the needs for specialist nurses. So if you're an RN, then look to see where a specialization is required and channel your efforts to get trained in that area. That's the only way you will be guaranteed to a certain extent the jobs that are required in that space. And that clarity is very important. We're doing that with the Barwin Scholarship. We have addressed where the specialization are.
A forward-thinking and transformative investment in the region's healthcare infrastructure. That's how stakeholders have hailed the $642 million new outpatient building project at the Mapen Hospital in Clarendon. Details in this report.
Mapen Hospital has been under pressure for some time to meet the growing demands. To address this, major infrastructure works have commenced. In 16 months, residents of surrounding communities served by the Mapen Hospital in Clarendon are set to benefit from a new outpatient department building being developed by the Ministry of Health. Ground was officially broken on Friday.
It's not just about buildings, it's about equipment, it's about more services, and hopefully a more efficient throughput for patients and a more comfortable environment for staff. That's exactly what this facility here is going to offer, this outpatient facility.
Health Minister Dr. Christopher Tuffton described the project as a necessary transformation and a critical milestone in the country's health sector.
The system has been starved of resources and investment over a very long period of time. And we had to, as an administration, embark on a significant and very comprehensive overhauling of the infrastructure in the first instance. Because if you don't have the buildings and the equipment, you can't provide the service. It's as simple as that. There's no big equation to the issue. And what we have done by designing and developing and are now breaking ground to build out is an entire new ecosystem for public health that will benefit all of us.
And the health minister said the sector is on a trajectory that is unlikely to be halted.
Contracts are signed, buildings are being built out, more doctors and nurses are being hired. Are we perfect? Absolutely not. Are Are we where we want to be? No. And we shouldn't be so extreme to give that impression, because it would be a false impression. But we are certainly better off than where we were certainly back in 2015, 2016, when this government took office.
In the meantime, Dr. Tuffton provided an update on plans to upgrade other health facilities in Clarendon.
2 health centers here in Mapen to be built up. Mapen East and West, correct, that are now in the design phase. So you're going to get 2 additional health centers. And Moko in the north, which is also going to be expanded and built up. I say all of this to say the parish of Clarendon has not been left out in the transformation of healthcare services under this government.
Prince Moore, TVJ News.
And it's time for a break. Stay with us, more stories when we return. Welcome back to the Midday News. It's now time for the Business Minute.
The Bank of Jamaica says it received 5 bids valued at $3 billion for the $1.5 billion in reverse repurchase agreements it offered to the market yesterday. The bank says it allocated only the $1.5 billion it originally offered at a weighted average interest rate of 6.1% per year. The lowest bid was 6% for $500 million, while the highest was 6.14% for $750 million. Further afield, President Donald Trump has officially delayed imposing higher tariffs on U.S. imports while sending letters to 14 countries, including Japan and South Korea, detailing the levies they face. The latest development comes as a 90-day pause the White House placed on some of its most aggressive import taxes was set to expire this week. The president renewed his threat of a 25% tax on products entering the country from Japan and South Korea and shared a batch of other letters to world leaders warning of levies from August 1. Higher tariffs had been set to come into effect on July 9, having previously been suspended, with White House officials saying they would look to strike trade deals. And that's it for the Business Minute. I'm McKenzie Robinson.
Time now for the top regional and international stories.
In the region, the UN Office for the Coordination of Humanitarian Affairs has warned that the Haitian border town of Belladere is under growing strain due to an influx of displaced people. Nearly half of the 121,000 Haitians deported from the Dominican Republic this year have crossed through Belladere, placing intense pressure on local services and reception facilities. Additionally, families fleeing violence in nearby Mirbali have also taken refuge in the town. The situation was observed during a joint mission by the Coordination of Humanitarian Affairs, UN agencies, and partners on June 28.
Thank you, Prince. We head to another break. When we come back, we'll have your midday sports report.